Ultrasound imaging always works best when the probe is as close as possible to the area being looked at, and to help make good contact, ultrasound gel is applied. Depending on the type of scan you're having, either a curved or flat-shaped probe is used. In certain circumstances, an internal probe may be recommended and is only used with your consent. Both curved and flat-shaped probes are commonly used for vascular ultrasound. So let's take a look now at which parts of your body are scanned for this exam. The aorta is the main artery in the body carrying blood away from the heart. In the chest, it branches to supply the head, face and neck through the carotid arteries, and further branches to supply the arms and upper body. In the abdomen, it divides at the navel into the iliac arteries. The iliac arteries are the main blood supply to the legs. As the arteries travel down to the toes, they divide and become smaller and smaller, finally becoming capillaries. Veins usually run alongside the arteries and return the blood to the heart. Lying relaxed on your back, will put warm gel on the side of your neck and slide the probe gently up and down. We will examine the wall of the arteries and take some measurements of the blood flow. You will be able to hear the sound of the Doppler signal while this is happening. This scan looks at both the internal and external carotid arteries and also the vertebral arteries. Both sides of the neck are examined separately. For an aortic scan or abdominal aortic aneurysm screen, we'll be looking at the aorta from the top of the abdomen to the bifurcation at the level of your navel. We're checking to see if there is any weakening of the artery wall. If there is a weakening, we will also check the arteries to the kidneys. As part of our peripheral artery disease screen for risk of stroke, we will also perform scanning of your lower limbs by moving the probe along your lower leg and checking the blood flow in the legs.